Good morning, everyone. I'm a little short compared to the Minister. This is our first workshop for today, and this is about a review of our consumer and community engagement framework, and that's the Health Consumers Queensland framework. Firstly, we have with us, as Mark said, Christine Petrie, who is from Metro North Hospital and Health Service and who is the Manager of Consumer and Community Engagement, and Georgina Lawson, who is one of our project officers. So all Queensland hospitals and health services are required to have a consumer and community engagement strategy. Primary health networks and private hospitals also produce these strategies. The strategies ensure engagement occurs directly with families, patients, and local communities to deliver improved health services. Consumer engagement is a key mechanism to achieve desired health outcomes. Also, it's used to empower consumers to work actively as partners in their own healthcare, as we've heard this morning. Our current framework, and I'm sorry, it's moving along. Here we go. So our current framework was developed in 2012 using a collaborative process with key stakeholders. It produced a framework that had application to and ownership by consumers and the public and private health and the community health services sector. The framework provided a consistent and overarching structure to guide and support the development of effective consumer and community engagement strategies. It reflected state, national and international approaches to consumer and community engagement while recognising that there is no one-size-fits-all approach. Supports developing strategies that are tailored to meet the purpose of the engagement and the needs of the consumers, communities and potential users of health services within the local areas. The current framework provides an overarching approach underpinned by a set of 9 principles that incorporate both consumer and community engagement, a model to support effective engagement strategies, and it's aligned with the national standards of the Australian Commission on Safety and Quality in Healthcare, and in particular, Standard 2, partnering with consumers. That is the framework as it is at the moment. So the framework also supports engagement occurring at different stages and in an ongoing way, involvement of consumers and community throughout the entire process, use of a variety of engagement mechanisms and methods, early engagement enabling the achievement of positive outcomes for both consumers, communities and health services, the provision of information to consumer communities up front about the level of influence that their engagement will have on the outcomes, the provision of feedback to consumers and communities about how their contribution has influenced the end results of that strategy. So now, given that it's 4 years along, there's been a lot of growth with health services and their involvement with consumer and community engagement and strengthening of partnerships. So we feel it's an opportune time for review to ensure that the framework continues to reflect current best practice, the learnings, and continues to be an effective support for all Queensland health services. We will be workshopping this with you this morning as the start of this process, and Georgina will lead that. But before we do, Christine's just going to talk to you from her perspective as a health service utilising the framework to develop their own consumer and community engagement strategy.
Thank you, Anne. Is that working? Yeah? I'm going to start by warming you all up because it is a workshop. So I've got 3 questions for all of you. Firstly, I want you to raise your hand if you've ever accessed a health service before and you felt like the information you've been given you haven't quite fully understood, or you haven't felt like you've been able to ask the questions that you wanted to better understand it. So raise your hand if you've ever had that happen. Okay, like a majority. There's a few people who haven't got their hands up. So next, I'd like to see who in the room has been a consumer on a committee or a project or a working group, who's been in one of those roles before. Great, okay. And can you, keep your hands up, keep your hands up. So of those people who have got your hands up, who's ever experienced tokenism, or you felt like you've had little influence on that committee, whatever? If you've ever experienced it, keep your hand up. A couple of hands went down, but yeah, there's still a lot of hands up. Okay, thank you. You can all put your hands down. I think herein lies the challenge for our health services, and I did hear Lynn say the word consistently. It's how do we consistently walk the talk and really put consumers at the centre of care and have them as partners. I think there are some fantastic examples, and a lot of those are going to be in the mentioned in the workshops later on. But for us, the challenge as an organisation, and a large one that I'll talk to you about with Metro North, is how do we consistently do that so everyone has a good experience and feels like a true partner. So this presentation, I'm just giving you a taste of the process we use to develop our strategy. And actually, thank you, Georgina, at Metro North, because the process was as important as the outcome in a lot of ways, if not more important, to engage with our stakeholders. So a little bit about Metro North. We've got five hospitals, the Royal Brisbane, Prince Charles, Redcliffe, Caboolture and Kilcoy. We've got a large community and ambulatory program and mental health and oral health services. On top of that, so it's about 16,000 employees. Then on top of that, there's about close to 1 million people in our local catchment, and add on the people from across the state who need access to our specialist services. It's a lot of people. And then we've got the complex mix of all our community and primary care providers that have already been talked about today, and there's a lot of those too. So where do you start when you're developing a strategy to try and engage people? We kind of looked at dividing up some audience. So actually I must mention that what we did with the Health Consumers Queensland framework was we used it as really as a guide for us in our process of engagement to help us look at who we needed to engage. So the key audiences that we decided we need to engage, and Georgina didn't warn me that I was up on the big stage and there was going to be a big photo of me. But we realised that this was going to be a balancing act between different perspectives. So when we stated a high-level principle-based strategy, like, let's all partner, let's put patients at the centre, or let's put people at the centre of care, everyone agreed. But when we started to look at, so how are we going to do that? That's when we started to get these different tensions arising. And so a lot of the engagement process was about how do we manage those tensions? So we broke up our audiences into a few key ones, and consumers and community being part of that, our board and executive, the staff, and also our partners. And what we found is that, we actually started by saying, okay, what would you like us to do? And we asked 3 questions. So if we were doing consumer and community engagement really well, and we were partnering really well with consumers, what would we be doing differently? If we, the second question was, okay, what are we doing well and what do we need to build upon? Because let's acknowledge what we're doing really well. And the third one is, where are the major gaps? So as we started asking these different audiences here those questions, we got some really different answers. And so then we thought, okay, we've got to really acknowledge the perspectives that each of these are coming from. So consumers wanted to start with, let's talk about the benefits of engagement right from the start. And also to respect the diversity of why consumers become engaged in the first place. Some because they've had a positive experience, others because they've had a negative experience and they don't want others to experience that. And so there was a whole diverse range and we needed to acknowledge that. The board and executive, they were like, what are the risks of not engaging? We want you to talk about that. The consumers, on the other hand, were kind of like, why are you including that? So we had to kind of manage this tension and explain to each of the groups why we're including certain things. The staff were just like, tell us what we need to do and make it easy. And our partners were like, hey, don't forget about us because lots of your consumers aren't just accessing your service, they're accessing a whole range and you need to work with us on that. So here we were trying to develop a strategy with all these different perspectives. So what we did was try to include and address all of those perspectives in our strategy, which is why we've got a large document, and most of you should have a copy of that on your tables so you can have a look at it. So what we found is even in something as simple as the title page, and we'll put that up, the title was really important so that one of our criteria was we had to make our strategy inclusive. So if we started using the term consumer, the staff were going, no, they're patients, and and then we started carer, then oh no, they're family, and there was all this debate around language. And we went, let's just keep it simple. What are we trying to do? What's the intent? And so we hope that our title is really engaging for all of those audiences, connecting for health, inclusive engagement, involvement, and partnerships. Okay, so after we kind of worked through all of the kind of different perspectives, what we realised is that people were essentially saying some pretty common things. And they might have come from, they might have been slightly different. We brought it down to about 7 or 8 different objectives. But then we worked with a small consumer group who helped us sort of cut to the chase, I guess, because in health we tend to use a lot of and I do too, I do it all the time, sort of fluffy language. But they were kind of going, just cut to the chase. So this is what the consumers came up with for us, and we now use it as our mantra. Wherever we go, we have it on all of our documents. The consumers really said, you need leadership. You need leadership within your organisation. You need consumer leaders to drive a culture of continuous improvement. You need to be inclusive, and I think the video shown by Renee this morning was a great example of the communication and how important communication is in being inclusive. Consumers were saying, don't just seek our feedback. We want you to be responsive to our feedback. We want you to close the loop. That kept on coming up time and time. Report back to us on what you're doing in terms of making a difference. And of course, integration, because consumers are saying it's a really complex system out there. I want to have a seamless care experience, not one that's disintegrated. So that's where we're at. And the challenges, which I've talked about in whole, but I think one of the biggest challenges was trying to bring heart and soul to what is really could be perceived as a pretty bureaucratic exercise of a tick the box. You've got to have that. Legislation says you have to have it, and accreditation says you have to have it. So we wanted to really bring heart and soul, and that's where the consumers again have come in. And for us, it's a continuous journey. We're now working with a small group of consumers on how we get the right language that they can use to take to other consumers to really sell our message of what our commitment is and our actions are to partnering with consumers. And they're doing videos, we're doing a video session next week to bring to life the stories. The other thing is we've found that some of the consumers are saying, we take it with us, that strategy, when we go to a meeting, and if we feel like the situation is tokenistic, we kind of go, hey, this is what your organisation's committing to. Do you realise this? And, they feel like it empowers them to be a little more proactive. So I guess we feel quite chuffed with the outcome. And the consumers have given us quotes to iterate that, I guess. I don't expect you to read them all, but that gives us hope that we're on the right track. And I guess I think in closing, I'd like to say that for me, it's about creating a culture of curiosity almost. Curiosity by consumers to learn more about the health system and what it means and how they can influence it, and curiosity from the staff to learn more about what matters most to consumers in this journey. Thank you.
Thanks so much, Christine. So good morning, everyone. We can try that one more time. Good morning, everyone. Oh, I'm overwhelmed by that response. So we're really excited to be kicking off the process in the framework today. As already discussed, it's been used across a lot of Queensland. You just put up your hand if you've ever looked at the document prior to today and used it? That's helpful. Good, thank you. It is a really good time to review it because I think a lot of the health services, like Metro North, have just completed their consumer and community engagement strategies for the next few years or are about to. So it's a really good time. There'll be lots of learnings like Christine's from those processes. So today we're going to kind of drill it down a bit because the framework's quite an overarching strategic document, but we want to make sure that we're looking at some of the fundamentals and whether it's still applicable and rings true today. So there's 32 tables. There's 4 questions, so each question is being discussed by about 8 tables each. Now, the areas that we're looking at, and the areas that you will have heard Christine speak to, I think. So first of all is the principles of consumer and community engagement. What are those basic principles that should drive our engagement in our sector? What are the benefits of consumer and community engagement to health services? So what do health services get out of it? Why should they do it? Benefits of consumer and community engagement for consumers. Why is it good for our consumers? And what needs to be in the framework? What are these fundamentals that we need to have in there? So this isn't about the actual actions that you do to engage. This is how it informs, the framework kind of informs how you think about engaging and what levels and levels of partnership that you should be thinking about using. So, on each of the tables, and this is where I hope that I have done my job, each of the tables have some A4 and A3 pieces of paper with the table questions on them. And there's also a couple of copies of the full framework. What's great about all these tables is you've got a real mix of health staff and consumers, so we'll have lots of different points of views at each table. Now, you each have a table lead, and I've dragooned 32 people into this process, so would you please just put up your hand? Can we make sure that there's a table lead at every... Is there any table that's missing a lead? Darlene? Do you want to be a table lead? Or Shelley? I don't know. Has everyone else's table got a lead? No one's panicking? Over there? Okay. Almost did it. It was almost seamless. Okay. Yep, okay. So, there's butcher's paper for you to write down your answers. Basically, we're just asking you to have a conversation around the questions at your table. I'll just ask for the lights to be turned up in the auditorium so people can read and write during the workshop. You've got, what's the time now? You've got maybe 25 minutes. I will come up and give you a 5-minute warning. If you've got any questions, and Chelsea and myself will be walking amongst the tables. Whatever's at your table. No, you've got one of them. Yep. Okay, go. Our network, you will see us advertise for a reference group to help guide this project. We'll be looking for members who are regionally diverse, from different backgrounds, to try and make the process as inclusive as possible. I will be doing a literature review to see how evidence-based has shifted and moved forward. We'll be doing an online survey of our entire network to try and make sure everybody can have a voice. We'll do some stakeholder mapping. And in July, I believe, the Australian Commission on Safety and Quality in Healthcare, I get it wrong every time, is releasing its next consultative draft of the standards. So we'll actually be able to have a look at them and make sure that our framework will align with that. And then from August, we'll start with the consultations. We'll be trying to do them across the state, especially as we come and deliver training to the various hospital and health services. We'll do at least one stakeholder forum. And we're going to call for examples of partnerships that have happened or are still happening in Queensland. So if you know of a really good example of consumer or community engagement, please don't hesitate to email me or someone in our team to let us know, because we want to fill this framework with examples of local practice. Moving on, we will commence writing and seeking feedback on the draft that we write. All throughout the process, we'll have the key stakeholders reference group, and then from January, we'll get it together to launch in early 2017. That's a bit scary. So housekeeping, can I ask the table leads to bring up their pieces of butcher's paper after this session, just because we're going to pile them all before the end of the day. Just another bit of housekeeping. Everybody on their tables will have 3 little yellow cards, or maybe not 3 anymore, and there's more out at our registration desk. Now, I think Mark mentioned it earlier. We're doing a panel this afternoon that's going to be looking at the wicked questions, the wicked problems in consumer and community engagement. If you've got a question that you may have asked previously, or you go, why hasn't this been addressed, or what can we do about this? It just seems all too hard. Write it down, because we want to actually address some of those questions this afternoon in our final panel. We'll be looking through them after lunch and picking a number out to cover. So think of the most controversial and interesting, wicked question you can and write it down and put it in the box at the registration desk. Thanks for your participation in that session. Really appreciate it too.
Thanks, Georgina. It's time for everyone to stand up and start moving. Unless you're staying here in the main hall for our next workshop, which is on the national standards as a tool for disruption to improve patient safety and centred care. That's with Naomi Poole, who is from the Commission. So that workshop is here. In breakout room 3 is another workshop, and that's a panel, lessons from the mental health consumer workforce and peer support. Now, so the breakout rooms are across the hallway. If you're going into breakout room 1, there are 3 sessions that will be held. 12 to 12:25 is Consumer and Health Staff Partnerships with Marta Young Adult Centre Brisbane, followed by Consumer Leadership, the Prince Charles Hospital Adult Cystic Fibrosis Centre with Doug Porter, and then Consumer and Health Staff Partnerships with the Patient Safety and Quality Improvement Service, Ryan's Rule, a statewide patient, family and care escalation system. That's 12:50 to 1:15. In breakout room 2, you have Consumer and Health Staff Partnerships, Caboolture and Kilcoy Hospitals, followed by Consumer Leadership with Westmoreton Hospital and Health Service, and followed by Consumer and Health Staff Partnerships, Aboriginal and Torres Strait Islander Health Cairns and Hinterland Hospital and Health Service. And that will be followed by lunch from 1:15 to 2:15. Thank you. And also, on your way out, or if you'd like to go to the front, Melissa and Nicole are handing out copies of My Health Queensland Future Advancing Health 2016.